During this session, we will be discussing masks only. So if you have other questions, we have had 2 other previous sessions that are on YouTube. So please feel free to look into those if you have other questions regarding sanitizing your studio, etc. So let me go ahead and introduce our panelists for today. We have Dr. Megan Meier. She's going to wave to you there. Okay, because she's probably going to show up in a different place for you than she is for me. Dr. Meier is a medical doctor, board certified in both family medicine and sports medicine. She is passionate about diagnosing both the structural and functional problems to help guide treatment and rehabilitation for dancers. She cares for dancers at all levels and is currently the company physician for the Oklahoma City Ballet and the University of Oklahoma Dance Department. And then we also have Dr. Julia Iafrate, also known as Dr. J, in the house. Okay. She completed her residency in physical medicine and rehabilitation at the Mayo Clinic. Woohoo, Mayo Clinic. And followed by a sports medicine fellowship at the University of Iowa. She specializes in sports and dance medicine and works with multiple dance schools in the New York City area and is one of the rotating team physicians for the USA ski team. And I am Dr. Linda Bluestein, a former ballet dancer and instructor, integrative medicine physician, and I specialize in treating dancers with hypermobility disorders. My medical practice is called Hypermobility MD, and I am also the founder and the co-host of the Bendy Bodies podcast. And I think that we may, actually before I do that, I think we may have a special guest in the house. Yes, we do. We have Alex Wong here. And I think maybe he was going to say hi to everybody. If you want to unmute yourself real quick and say hi, is that okay?
Hi.
Alex, welcome. We've all been very happy with your mask wearing dances on Instagram. So good job.
Oh.
So proud.
Love it.
Thank you.
Maybe it would be cool if you're okay with it to just talk about your experience quick with wearing a mask, because I have seen you dancing with one on, and then I can kind of expand on some of those things.
Okay, sure. So I live in New York City. As probably a lot of you know, we were really affected by this pandemic. And so I think people are definitely extra cautious here. We have not returned to anything indoors. So I have not been dancing indoors, dining indoors, any sort of gym or any sort of activities. So all the dancing I do is outside. I first and foremost want to set a good example for my younger dancers and my fellow dancers that follow me, because I think mask wearing is so important, and especially when we're not able to be socially distant, to be doing that. And so I think that is the most important thing. I think I see a lot of people, it's not a lot, I get maybe 1 or 2 comments out of like 1,000 that are like, it's not healthy, you can't be doing that. And I'm like, first of all, it's a piece of fabric. Second of all, there are several athletes that even train with masks, you know what I mean? And so I think, like, I know for me, I'm personally strong enough in my health and stuff like that to be wearing a mask while exercising. And even on top, some people actually do it for training purposes. So, I mean, it doesn't really affect me as in terms of like a minor inconvenience for the greater good of it all. I mean, I'm not a healthcare professional, but I just think that we can all try our best. I know everyone wants to dance, and if this is a way that can let us, continue in the safest way possible, I think it's worth it.
Yeah, exactly. And actually, Alex, you made a couple good points there that I want to expand on a little bit. So you said, well, it's just a piece of fabric. Exactly. It's just a piece of fabric. And there are lots of people that with their normal day-to-day outfits wear a piece of fabric in front of their face in the first place. Okay. I see a lot of people wearing bandanas just as part of a fashion statement even. The other thing is that there are many athletes that do train with masks on to try to help improve their cardiovascular function. And that includes your heart and your lungs. Your heart is a muscle, just like your bicep is. And so we can actually make it stronger by training it to work in environments that are not as, comfortable for it. Alex, did you find that when you first started wearing a mask versus now, has it gotten easier for you to dance in it?
I feel like honestly, it's always about the same. Okay. So it's depending on the situation I'm in. So I did teach a virtual convention a month back where I did have to go indoors. Although there was nobody in the entire ballroom, there was people probably about 30 feet away. I switched up and wore like a KN95 mask. So just like something a little bit better. It, you know, it doesn't have a full complete seal like I do when I go to the grocery store. I wear like a full seal with no completely airtight, but it was a little bit harder when I'm wearing something really, really thick. But when it's just like a fabric, I really doesn't really make a difference.
See, that's great. And that's because you are very healthy, like you said, and you have good cardiovascular function, and you've probably been maintaining your strength and conditioning throughout all of this. For the most part. Probably not quite as strong as you were. Nobody's as strong as they were in January, unless they have like a home gym. But the other thing that's kind of really important for a lot of these dance studios to remember is that a lot of your students are not going to be as cardiovascularly fit and not as conditioned as they were back in January. And so training yourself to be in the mask, you might feel crappy in the mask, but you might also feel crappy without the mask initially because you have not been dancing at this same level as you were 6 months ago. So being able to kind of give yourself time to develop a plan with gradual increase in intensity, both with the mask on and in general, is going to be helpful for a lot of them. So I think just because you put on a mask and you go, this doesn't feel good, a lot of times that can be anxiety that's more of the big issue. It's about perception of feeling like I can't breathe. And most of the times that's because of a bad fit. Like Alex mentioned, certain masks for certain things, right? If you have something that's a very tight seal or is very close to your face and you feel like it keeps sucking into your mouth, that's not going to be a good fit for dancing. I have a slew, I wish I could show you all of these. I have a slew of masks here. And this is like just a simple fabric mask, right? Now I could wear this walking around, no problem. But if I were to try to dance in this, I would suck this into my mouth in 2 seconds. It would get wet. It would stop being as useful, and it would bother my tongue. It would bother my mouth. It would make it hot and hard for me to breathe. Whereas something that's got a little bit more structure to it, this is from Keen. I'm a big hiker too, so I wear stuff like this, but this one holds some structure. So when it's wet because I washed it, but when it's on my mouth, it doesn't pull in as much. It doesn't get sucked into my mouth as easily. So, and a lot of the other masks that have the little nose pieces can kind of hold that cone shaped structure a little better. And if you guys follow me on Instagram, you might have seen me talk about this little mask bracket thing that you can actually put into a mask that will, again, hold the mask away from your face. So it makes it more of that cone-shaped mask. I mean, it looks ridiculous. You look like Hannibal Lecter, but it's really, really helpful to stop that fabric from getting sucked into your mouth, which is, I think, a big problem for most people, is that it just feels offensive getting pushed into your mouth. So yes, people should be wearing masks when they're dancing because we are in, for the most part, somewhat enclosed spaces, older buildings with poor ventilation, and usually indoors, usually inside. And especially if there's, ballroom dancers, you're doing some partner work, whether you like it or not. Now, should you be? Probably not. But if you do it as safely as possible, then it's kind of a little bit more justifiable. But wearing masks is going to be the greatest thing that you can do to help everyone prevent the risk of spreading this thing. 50% of people are asymptomatic carriers of COVID thus far. We know that if somebody is sick and not wearing a mask, even if you're wearing one, there's still a 70% chance of transmission. Whereas if you're both wearing masks, the transmission risk goes down to about 5%. That's a massive improvement. So if we want to continue to dance, then we need to think about the best ways to do this. And wearing a mask is one of the best ways we know how. Socially distancing, yes. Washing your hands, absolutely. But masks can be a very simple thing to do. And I'm going to be slightly crass here. I hope you don't hold it against me. But just like leggings, just like condoms, and just like tampons, one size does not fit all. Okay? I know that sounds kind of weird and creepy, but it's true. One size doesn't fit all. So if you find that you wear a mask and it just feels awful when you're trying to dance, maybe it's anxiety or maybe it's a bad fit. Find something that fits you well. I have literally 17 different kinds of masks here. Okay, I have every kind of mask possible because for certain adventures that I go on, I need a different mask. So that's kind of a big thing for people to think about. Alex, do you feel like I covered a lot of what
Totally. No, I actually couldn't agree more because I have like 10 different masks, like
Exactly.
literally for every occasion. Like I have like a silicone one with a full seal and an N95 filter. Then I have my other ones, and I have my fabric ones. And for every outing, I use a different one.
Exactly, exactly. And so speaking of the N95 idea, so this is a cone mask that's, it's actually a fake N95 because it doesn't have the NIOSH. So you guys might see on there, see where it says NIOSH? That means that this is a certified N95 mask. This one does not have any such thing on it. So this was from, I don't know, I bought it on Amazon from somewhere. But it's a cone-shaped mask. It makes it kind of easy to breathe. So it's not a bad option, I guess. However, a mask like this that has the little ventilator. So this is also an N95 mask. It's too big for my face, so it doesn't work like an N95. But as I had mentioned to you guys before, there is some risk with these because these filters filter the air coming into your mouth, but don't filter it going out. So if you happen to be an asymptomatic carrier, if you are unable to get tested all the time, like we are in the healthcare field, then, or professional athletes or something like that, then you might be blowing out unfiltered air without meaning to. So if you're gonna wear one of these because you like how it feels and it keeps the mask off of your face, then you might wanna think about wearing one of these with a different mask over top. So I would literally be wearing it like this so that it stops any particles that I'm blowing out from going anywhere. Respiratory droplets are not your friend. We don't want to share them. It's like cooties. Pretend we all have cooties again, okay? We're going back to grade 2. And then the aerosolized particles can actually stay in the air for up to hours. So again, with dance studios that have poor ventilation, you're gonna have like 3 dance classes within 3 hours of each other. And that means it's not just your class that you've shared those particles with, it's the class before and after you as well, okay? We asked about safety for kids. So yes, generally speaking, masks are safe for children to wear, presuming they are able to do 2 things. Number 1, tell you if it's bothering them, and number 2, move it. So if it's suffocating them, they should be able to have the hand dexterity to move it. So if you have a child that has, you know, some sort of genetic disorder or is unable to kind of tell you in some way that the mask is obstructing their breathing, they might not be good people to have masks on. If you, so, you know, generally they say less than 2 years old shouldn't be wearing masks. I totally agree with that. This range of 2 to 5 has been up for debate. The WHO, or the World Health Organization, just came out with something saying, oh, maybe we shouldn't have kids under 5 wearing masks because generally speaking, they don't seem to be very likely transmitters. But like you guys have seen, things have changed since March. We've had multiple different opinions over the last gosh knows how many months, okay? So things are always changing. So what we know now might not be exactly true for what we know in the future. So if we can try to protect them as best we can, I think that's a great idea. If your child just absolutely cannot tolerate it, then, you know, maybe better than nothing is the idea of a face shield. Face shields. Now this is a very fancy one I bought online strictly so I could show you people it, okay? It does not look like the usual masks now, or the usual face shields that we wear in the hospital, but there is some literature that is looking at could face shields take the place of masks? And right now the answer is no, they're not as good because respiratory droplets can still drop down. Aerosolized particles can still move around. However, if there is somebody who absolutely cannot tolerate a mask, or if you have young children that you're like, oh, we don't know if they can actually remember to remove it, or they're getting, you know, major increases in their heart rate, which is increasing their risk for syncopal effects, whatever it is, then maybe this is the next best thing. Now, this thing should wrap around the sides of your face and go under your chin. I'm gonna put it on and I'm gonna look super cool, and you're not gonna be able to see my face because it's for the sun. So this might be kind of cool for running into. But anyways, this is what it looks like. Okay, I know I look super awesome, and I'm pretty sure I could join like Daft Punk now. But this is a face shield that actually goes below my chin. So if I am dancing, this at least is going to limit some of the spread of my respiratory droplets that are at least spewing out from my mouth, okay? When you are dancing, when you are physically exerting yourself, when you are singing, when you are yelling, all of those things equal you are spreading respiratory droplets further than 6 feet. The 6 feet rule doesn't apply anymore. It's past 6 feet. And that's why we're recommending that you space out even further. People with asthma, people with respiratory disorders that just absolutely cannot tolerate a mask, might want to consider at least something like this. First, try all the possible masks you can. Find one that fits. Under Armour makes one that's actually bumped out now. I tried to buy one for this, but they're on back order right now, unfortunately. But Under Armour has one that kind of boxes out a little bit. Maybe that might be a more comfortable option. So try a couple. Like Alex said, he has 10. I have 17, okay? And then if not, something like this might be, you know, your next best to last option. And then the last thing, teachers should definitely be wearing masks, again, because they're usually yelling out counts, okay? So they should definitely have a mask on. You might want to consider having a microphone so that you don't have to yell as loud. And then I told you no valves. We don't like valves. If you're going to use something that has a valve, cover it with some other mask. And then the last thing is changing your mask. So I would change masks anytime it gets wet or in between dance classes. So if you have a class that it's like, oh, this got a little soaked, time to put on mask number 2. And then if you are really having a hard time tolerating the mask, finding a safe little corner of the room or going towards a window so you could just kind of pull the mask down for a second, breathe some air, feel refreshed, and get back in there is fine. But again, you have to train yourself to get good at the mask. Okay, I'm done.
Okay, fantastic. All right. And I know that Dr. Meier, I think, is going to be back with us in just a second here. So in the meantime, I can talk about some of the things that you touched on briefly regarding people that have perhaps medical reasons why they may have difficulty wearing a mask. I know that there's been lots of questions we've received regarding medical and psychological challenges that people have wearing masks. For example, anxiety, maybe they have autism, a history of trauma, sensory processing disorder, things like that. So I'm going to cover that. Also, taking the mask off and putting it on properly. Another question we received had to do with my owner believes masks aren't safe to work out in, and so many students do not wear masks. What do I do? Please help. And then parents being concerned about oxygen levels and pulse oximeters. They would like to know about pulse oximeters. And then another question about what kind of masks should we be wearing because we are often breathing so hard. So I'm going to see if I can share my screen here real quick. I did it before, so hopefully I can do it again without too much difficulty. Does that show up as a, okay, cool. All right, so, oops, but it didn't advance. Oh, there we go. Okay. So the things that are, first thing to know is that we don't have massive scientific studies about this, and that's really what we need. You know, in an ideal world, we would have lots of studies showing, you know, what are the different things that cause difficulty wearing a mask, and what are the things that we can do to make that better. And we just don't have a lot of studies. Yes, there are masks that have been worn in the past for things like training the cardiovascular system, as was mentioned earlier. The slight decreases in oxygen or increased in resistance to airflow can actually be beneficial for athletes. But we need to make sure that we are talking about what the individual needs are of all the different people, because it's going to vary dramatically from person to person. So here are some of the variables that are really important. So the first one is, depending on the type of mask, that will influence the resistance to airflow. So for example, how thick the mask is, the type of fabric, and Dr. J covered really, really well the idea that there's a whole bunch of different choices. There's a bunch of different fits. You can do things so that you're not sucking the mask in. But these are some of the things that really matter a lot. So just because you have difficulty with one mask doesn't mean I can't wear a mask. So that's the first thing to keep in mind. The individual variables of the mask matter a lot. The second thing is how wet the mask is matters a lot. So if the mask is wet, it is going to create more resistance to airflow. So it's really important to make sure when you bring your mask or masks home, if you've maybe even used more than one, bring them home, wash them, dry them, make sure that they're dry when you use them the next day. And if you're having difficulty breathing, perhaps you just need to put on a new mask. And wet masks can also promote more growth of bacteria, viruses, etc. So it's important to be dancing in a dry mask. The other thing is level of exercise intensity matters a lot. So if you are deconditioned because you've been out of class, or maybe you were sick, you had a cold or whatever, and you're not in the same condition that you were in before, then you put a mask on, it's going to make it even a little bit harder, perhaps. So that doesn't mean that you can't wear a mask, but that means that maybe you need to take a step back, practice wearing a mask at home when you're doing nothing, when you're sitting and watching TV or something, or sitting and texting a friend, and get used to having that mask on your face, and then gradually do more and more higher level intensity work with the mask on. And you can do that at home. Like, just tell yourself, okay, I'm going to wear it for this many minutes, and now I'm going to wear it doing this activity, and that will help. As Dr. J mentioned, the airflow in the surrounding space is really, really important. Ironically, in the same spaces that where we need the masks the most is where we might have less airflow and have more difficulty. And that's why it's so important to practice at home. It's like training anything else. As dancers, we know how to train. We know how important it is to be really disciplined and to keep working at things. So practice at home as much as you can, and just keep in mind that that may be part of the challenge. So if it's hot or if it's kind of stuffy, it might make it harder to wear the mask, but then it also probably makes it even more important to wear the mask, because that's when you're more likely to potentially expose other people and be exposed. And we all need to be wearing masks to protect each other. I wear a mask not to protect myself as much as to protect you. So it's super, super important that we are all wearing masks whenever we possibly can. And if we can't wear a mask, then we need to think about, can we go to the studio? Because as Dr. Meier mentioned last time, dance is a privilege, not a right. And we need to keep our fellow dancers safe. And if we're not wearing a mask, we can't be keeping our fellow dancers safe. So as Alex said, if we want to keep dancing, we want to keep studios open, these are the things that we have to be doing. And Dr. J pointed out extremely well that the whole 6 feet thing, it's not like it's not a magic distance where the viruses just like die after 6 feet. If you're singing, if you're breathing really hard, you're talking really loudly over the music, your particles are going to go a lot farther. If you have a heavy viral load, say you have coronavirus and you have a heavy viral load, even if you're asymptomatic, you are going to shed a lot more virus, and it can travel a lot farther. And then the health of the athlete or the dancer matters a lot. So if you have any type of respiratory problem, cardiovascular problem, if you have a problem with your autonomic nervous system where you have difficulty regulating your body temperature, you can't dissipate heat as well as other people, it might make it more challenging. You might have to work harder at exercising and dancing in a mask. That being said, you may be able to get to the point where you can dance as much as you want in a mask, but it's not a guarantee. Most people are going to be fine and be able to dance as much as they want in a mask. But there might be a small subset of people for a variety of reasons, whether it's because they cannot find the coping skills to overcome their anxiety or whatever, that they are not able to wear a mask. In that case, though, they may need to dance at home. They may need to continue dancing at home. The default isn't to just then, I'm going to go out and just, make other people sick. So those are important things to keep in mind. It's confusing because the CDC and the WHO have come out with these statements. So the image on the left is from the CDC, where they talk about the wet mask may make it difficult to breathe. And they talk about doing high intensity activities like running may make it difficult to wear a mask because it may cause difficulty breathing. So you conduct the activity with greater ventilation, air exchange, and or lower the intensity till you're able to tolerate it better, and then work back up. The dance docs also did a podcast. They discussed this very well also. The World Health Organization has said, they have a comment right here. I don't know if you can see my arrow or not, but people should not wear masks while exercising, as masks may reduce the ability to breathe comfortably. It's true that masks may reduce the ability to breathe comfortably, but if people want to dance, we're not in this situation where we can just jog outside, and dancing usually occurs in a studio. So our choices generally are to not dance or figure out ways to dance and make it as safe for people as possible. So, we need to just keep in mind, when the WHO puts out a statement like this, they're making this statement for everybody, and they need to err on the side of caution. So just keep that in mind. I know that it can be confusing. I'm actually going to come back to this. How are we on time? I want to make sure we have plenty of time for Dr. Meier. Okay, So some things that can occur, some symptoms that can occur if you are having difficulty wearing a mask while exercising. You might feel like confused or like you're having difficulty thinking. You might feel short of breath, feel air hunger. You might feel dehydrated or overheated, and you might feel a little dizzy. Those things though mean that, you know, maybe you need to go outside, take your mask off in a safe place, and or decrease your level of intensity. So, you know, you have a couple of choices. And then, you know, maybe that means you need to work at home and figure out how you can either work with a different mask, as I said before, and Dr. J said, or figure out how you can work your activity up more gradually, your level of intensity. I know some people have asked online about color change. If you are starting to turn blue, like that's a pretty late sign. So I put it on the list, but that's a pretty late sign. Some things that you can do if you are having difficulty wearing a mask. You can take a short mask break in a safe place. And I know Dr. Meier shared with us over the weekend that Oklahoma City Ballet, they have corners blocked off where a dancer can go, face into the corner, and if they need to, take their mask off. And I think she said it's 8 feet. She can clarify that exactly. But that way, if they absolutely have to do that, they can. And this really, I think, is a great thing because it lets someone know that they have another option, and it can lower that anxiety. Because when it comes to anxiety wearing a mask, the important thing is to develop coping skills that will help you with that anxiety. And the beautiful thing is that will help you deal with anxiety overall as well. So if you work on slowing down your breathing, that will decrease the utilization of oxygen, that will decrease the production of carbon dioxide, calm down your autonomic nervous system, and that benefits your immune system, which makes it less likely that you're going to get COVID. So if you can figure out ways to calm your anxiety, calm your nervous system, that's hugely, hugely beneficial. So that's a skill that you can translate into other areas of your life. It will also help you sleep at night. You know, you get in bed and your thoughts are racing and whatever, that can really help. Make sure that you are thinking about, am I adequately hydrated? Sometimes when we're wearing masks a lot, it makes it less convenient to drink water, and we may, even if our temperature only goes up a very, very tiny fraction, maybe we need more water than we normally do. So make sure that you're staying adequately hydrated. Dr. J is going to demonstrate for us right there. Yes. Also, as I mentioned, build up to wearing the mask more gradually, especially with higher intensities. Replace a wet mask with a dry one, and consider replacing a cloth mask with a disposable surgical mask if you need to. You know, so those are masks that have, you know, very, very little resistance to, thank you, very, very little resistance to airflow. In the operating room, I would wear these for literally, you know, 12 hours, 24 hours at a time. You know, if you're on call and you're working those 24 hours, you literally have a couple bathroom breaks and that's it. And I have asthma and I have dysautonomia. So, you know, and I was able to wear a mask, you know, in the OR for all that period of time. So that's another option for some situations. Actually, I'm going to come back to the, because I don't think I had, okay. So in terms of pulse oximetry, so lots of people now are getting home pulse oximeters, and I do really encourage that people have one. I think it's a fantastic thing to have. A couple of quick things to know about pulse oximeters. They only, sorry, I'm just checking the time. Okay. They only measure oxygen, not carbon dioxide. So they do help with that, but they don't help with the carbon dioxide piece. And our lungs and our whole cardiovascular system, the whole goal is to take oxygen from the air and deliver it to our tissues. And then they take the carbon dioxide that we generate and get rid of it. So those are the two like big things that our lungs and our heart do that are super important for the body and not to build up lactic acid, et cetera. So pulse oximeters can be used to, here's an example of one. I almost forgot to do my demo. So here's a pulse oximeter, and you can see my pulse is probably really fast because, you know, nervous. Okay, so actually 72, I'm surprised. Okay, but my oxygen is 99%. Now, this is not a, you know, medically operating room pulse oximeter. This is one that's designed for home use. And I did find this study where they looked at 6 inexpensive home pulse oximeters that were not cleared by the FDA. And the bottom line is they had lots and lots of errors. So you just need to keep that in mind. If you're feeling really, really sick, really, really short of breath, don't put on a pulse oximeter and say, oh, my oxygen is okay, I guess I don't need to go to the emergency room or call my doctor. Call your doctor, see what they say. This is just another piece of information, but don't let it be the end all and be all. Listen to your body, learn to be in tune with your body. That's really important. Another thing to keep in mind is in science, we always have like this is the number plus or minus. So pulse oximeters, even in the operating room, it's plus or minus 3%. But we have found that in darker skinned people, there's some scientific evidence that it's plus or minus 7%. So that 7% can be really significant if you're, say you're 92% or something, and that's really 85. This is more critical, like in the emergency room when we are evaluating someone, than it is in a dance studio. But I just wanted to let people know that, there's a lot that goes into pulse oximetry. What's your baseline level? What are the other symptoms? What's the carbon dioxide? So this is something that you can, use, but make sure you're also really listening to your own body. And I think we will only come back to this if we are, I think that Dr. Meier is going to talk about that. Also, if you could talk about if there's any feasible way of holding a dance concert responsibly. What about socially being distanced on stage? And if you could also cover group photos. I think a couple of other things that were covered, like gloves, ballroom dancing, traveling across the floor, and if the flooring is spaced out 6 feet apart, do they still need to wear masks while dancing? That's a lot.
Sure. So we'll start with that last one that you said. I think that like we kind of already touched on, with dancing, we are huffing and puffing. We are more forcibly exerting any kind of breath out of our mouth, which is going to carry the droplets, which is going to carry any kind of viral load to expose people. So that's the whole reason we're wearing masks. I think a common misconception about these masks is that they keep the virus out. And yes, I get what you guys are saying. The virus is so tiny, it can, of course, get through the mask. What the mask is preventing is these droplets mainly that the virus lives in, that they can really carry a lot of virus in. And so if I'm just talking normally, they found the spray of all of that is about 6 feet. And so that's where it's great, the idea that we do the 6 feet spacing, and then we have the mask to limit that spray to just a few inches. And so then we kind of have, extra ways to keep that viral load from getting to the next person. Now, when I'm speaking more forcibly like I am right now, or shouting or even singing, they found that can go even farther, let alone when I'm huffing and puffing and, trying to dance. So that said, if you are the instructor and you are shouting and talking to your dancers, you are most likely going to expose them beyond that 6 foot range. If you're dancing and you're breathing hard, which many of your dancers will be, we're out of shape, we're trying to get back into everything right now. I think that we need to try to consider that 6 foot is not as safe as, the number that they've set. It's not some impermeable barrier at 6 feet that we're talking about. So that said, that's where we use all the different precautions, that it's not just about the masking, it's not just about the spacing. It's about doing all of it. And so as much as we can space, I like to shoot for more of a 10-foot space if we can in dance. And I think you can do some of that in more of a staggered manner in your studios. And then I still think we do need to mask, just have that extra precaution. As we've talked about, this is more to prevent the spread. This is more for each person to do their part to stop the exposure and keep it out of your studio. And so looking at it more from that perspective, I think makes a lot of sense to me, at least, versus thinking about, can we just do one? Can we do another? Can we shield? I think shields are a good last resort if you have nothing else, but a lot of cases, we're still getting things moving from that shield. And, especially if we're trying to do across the floor and things like that, it's just probably not as good as having a mask on your face. So that said, across the floor, that's a question that we get quite a bit is, can we go across the floor? Because as I'm moving across the floor, I'm leaving a trail of my breath behind me. And so I think that if we can space and stagger across the floor, it makes sense. Droplets hang in the air, for up to 3 minutes in some studies. And so if we can mask, we can go across the floor one direction, we can kind of be more creative about how we're doing that to not necessarily crossing the same path over and over, back and forth. You know, I think just kind of strategize. How can we use this part of the room? And then we use this part of the room. How can we space? Because there have been studies in runners. If you're able to space and stagger your runners, you don't get as much spray from behind. And so if you're doing more of those creative techniques in going across the floor, I think you can go across the floor. We're not going to be bunched up like we used to. We're not going to be able to do, you know, just this tight go in two groups kind of model. It might be that we have two go across this way, and then we have two meet up at the top of like a point, and then we do it again, the next group kind of going across to where it's almost in like lines, if you will. I recommend marking the floor to where that way you can just say, get on X1, get on X2, or A or B, or however you want to do that. And so that way you already have your tracks that you're using. I think as far as breaking, a good idea to just maintain the space for everybody is have chairs spaced around the perimeter of the room to where if somebody needs to go and take a break, if they need to get a drink of water, that's going to be their designated space that they can go to, that it's sanitized before, it'll be sanitized down after, but that's going to be their spot, and that part is spaced at least 6 foot from the next spot. The reason I say 6 foot here is because I don't anticipate they're huffing and puffing and shouting when they're on their break spot. And so I think that that's a good spot to be. Their bags can go under that chair. It kind of keeps the room clean, keeps everybody just going to their own little place. I've recommended having those break spots for where you can unmask, that's away from the chairs, it's away from the action dancing. If you can space it, you know, 8 to 10 feet from where the action is taking place, have the dancer turn toward the wall, just take the mask off and deep breathe. I think that can be really helpful. I've had dance studios do that and find that really people used it up front, but as they got used to the mask, I think kind of even knowing it's there can be very helpful. Knowing that I don't have to just have this thing like on my face. I have an exit strategy. I can go, I can take a deep breath. It really helps for that anxiety piece of I am not trapped, I am in control. And I think right now that's where so much of the anxiety comes from. And all anxiety is that lack of control. And so giving your dancers and yourself the ability of having control over the mask wearing in the situation can do a lot for the anxiety of it. And so I think that also includes the ability to pick a mask that's right for you, to be able to find one that fits your face. Even for my little biddies, I have little girls at home, just having the control of having something that they liked, they were comfortable on, that made them so much more compliant and comfortable with wearing it. In fact, today, my daughter left her mask at school. Why it was off her face, this is a different issue. Left it at school at the end of the day as she was getting into the car. And so we had to do just a surgical mask over her face to go back to school today. And she cried and she was upset. And so again, giving back that control at all levels with the little biddies up to the bigs, I think is really important. And so with the space, I think if we can utilize the space in a smart, creative way, there are safe ways we can have a more normal class. Right now, I look at dance classes as probably a no-go for partnering, at least until we know more about this virus, we have a better handle. I would say let's keep the space and just take partnering out. Let's take the floor work out if we can, unless we can kind of do it in a designated space, preferably on a mat or something that can be cleaned. But it's just not worth all the extra contamination of the touching. And so I would say limit that. Reason being is because your dancers are going class to class. It's not a consistent cohort that they're working with. And so I just don't want to have super close contact where person A may be spreading to person B, who now goes to hip hop and does something in that capacity, and then we're just spreading. And so a question we get asked an awful lot, well, what about dance types that have to have touching, like ballroom dance? That's a good question, because it's really hard to do anything ballroom dance without touching. And so ballet, we can do some cross training, we can do bar, we can do some center work, but how do we do this in partner-based styles? And so I think that's something that we need to look at as far as what does your class look like? You know, this is where we can't do the moving from class to class to class moving partners, you know, and I've taken plenty of ballroom classes where you're changing partners as you're moving around the room. That's just probably not something we're going to be able to do. If you can have a designated partner and it's just you and that partner, or maybe that partner has another partner, I would still 100% mask. But you guys, if you have ballroom dancers that you're training, it needs to be understood that those two partners are making a commitment to each other to, one, be masking, two, make good decisions about spacing everywhere outside, you know, and three, that we're not going to be changing around partners, that this is almost like a family member at this point, that the person you're choosing to partner with is like the people you're choosing to live with. And we're not really masking around the people we live with because we live with them. I'm not going to say do that outside of your home, but as far as the closeness, you're going to do that just with that little cohort that you're working with. And so while I'm not recommending cohorts and pods for classes, as far as companies, that's something that I am recommending, that we are still masking with our cohorts and our pods. We are still spacing, but that we are able to start integrating more close contact within these pods. And pods, the difference between pods and companies versus classes is people don't go in and out of the pods. So that pod trains together. That pod does all of their classes together. They're not going to extra classes. They're not interacting with other pods. And so we're keeping one pod safe. And so as you're looking with how am I going to perform, many of you, if you're listening in your more professional level or collegiate, and we're looking at classes, if we can keep those pods consistent, I think we have a better chance of looking at how we can do things like performances without having somebody go out and losing them. So that's better for your planning. And then also looking at how we can start to do things like partnering, because that is such a big part of dance. And so my recommendations is this is basically your bubble. I keep using the term bubble with the different groups that I've been working with, is we don't want to have people coming into the bubble and out of the bubble. We protect the bubble, and everybody who lives in that bubble is responsible for protecting that bubble. I say to all my bubbles, I feel like it's reasonable for you to kick people out of the bubble if they're not making good decisions. So if people are posting pictures on Instagram all huddled up with their friends after school, or if people are posting where they're out at the bars, you know, with your collegiate and your professional dancers, then that would be reason that they're not welcome back into the bubble. That said as well, if somebody has symptoms, they don't come into the bubble. If somebody has had an exposure, they don't come into the bubble. This is protect the bubble, because if it pops, we are done. And that whole cohort goes out if that is the case. And so that's the recommendation I've been making with that, is that if somebody within the bubble is positive, the whole bubble is basically treated as though they were exposed. And that's the way that I've been using the cohorts. The nice thing about that, if you have the capacity to do these pods and these bubbles, that way you don't have to shut down your whole situation because of one positive or because of one bubble having a problem. So that's going to be, I think, the safest way that we can do this. But as far as whole studios, if you have people doing different classes, which is basically everybody, I just don't know that that cohort model is going to work. You could reasonably do that as far as how we're training to put together performances by doing this cohort piece. But in the event that you can't, I think performances are possible in concerts. But again, it's about the creativity. So if we're able to train and you're able to choreograph in a way that keeps people pretty spaced and pretty distanced, I think you can start treating this just like any other choreography. You got to maintain your spaces and your lines when you're doing other types of choreo outside of pandemic. So just treat it in that way and get creative with that. I think it's reasonable to keep your dancers masked to do this. Other than the optics, it doesn't hurt anything to perform masked. And I think that if you're able to do that and then space your audience, it makes sense. You know, if we're looking at like with live music, you know, having like, you know, Oklahoma City Ballet, we have the Philharmonic playing in the pit, we're going to have to mask because we can't risk each other's exposure. And the Phil playing their instruments, that's going to be a risk to the dancers, and the dancers huffing and puffing is going to be a risk right back down to the Phil. So I think that it's very important to think about that. Performances aren't just like a special treat. We get to not worry about this anymore. The virus doesn't care if it's a performance or a practice. We still have to mask and we still have to do these things. So for now, this is what I would recommend. If you need to have a concert or a performance during this time, as in end of August 2020, that's what my recommendation is. The nice thing is one, this isn't going to be forever, and two, this isn't even necessarily going to be my recommendation all season, because as we get more information, as we get more data on what works, and we get things like vaccines, we get better treatments, all these different things, we're probably going to be able to evolve this along. So is this going to be what your 2021 season looks like? Is this going to be the way you have to plan for your May recitals? Not necessarily. So I don't want you to get discouraged by this idea of this is what we're doing now. I just want you to accept that this is what we know works right now. So this is how we're going to still be within that parameter. So going back to performances, I think the audience is equally important, and the audience will pack in there if you let them. You know, I personally, I would go to the ends of the earth to see my kids do anything. And so one thing that I really liked about my kids' studio is when we had our spring performances, they required a mask to come in. Everybody was checked at the door as far as temperatures, are you having symptoms? And one at a time were brought back. We had people come through, and then we stopped at pictures, and the masks were removed for pictures, and the photographer was spaced way back. We got the picture taken, and then the moms could take their pictures just one-on-one, and then each dancer was brought in and put on their mark. Each person was kept on their mark. There were marks on the floor in the space for us where we were going to sit as far as our seats for the performance. And so all the parents were spaced about, it ended up being about 10 feet apart. The dancers were spaced on the stage. And it was good. It worked. And I had a 3-year-old, like a young 3-year-old that was in this, and she complied. And so just having that extra effort, the extra creativity, which you guys are artists, you know, you wouldn't be studio owners and teachers if you weren't. You know creativity, and you can do this, and you can be able to strategize how you can apply the techniques you use with choreography to the techniques that you use with the spacing and with the across the floor and with the not partnering. It's just going to be different. And so using that right now, I think look at it in chunks. That's going to be the way you strategize your fall season. And then we'll look at, again, a new strategy for things as they change. As far as moving forward with the masks on and gloves, what we want to do there, because that was another question, especially with partnering in ballroom. Do we need to be gloving? My thing with the gloves, and ladies, correct me if I'm wrong, please jump in with some dialogue. I don't know that gloves are important here. And so I see all these people doing gloves. I've seen some companies now marketing gloves with the touch piece. I think if your hands are cold, that's good. But I don't think that the gloves are going to prevent COVID, because if I'm touching any surface that could be at risk, that glove can still transmit to me. My skin is a beautiful barrier that is amazing. It's just as good, if not better than gloves to keep COVID out of my system. The problem is my nose and my mouth, on my oral mucosa surfaces, they're not so good. My eyeballs not so good with keeping COVID out. So those are the places I want to protect. And so I'm not really as concerned about you touching stuff. I'm concerned about you keeping your hands clean. And so touching something with a glove that is dirty than touching your face is going to be just as risky as with your hands. And so partnering, I don't think, is any less risky using gloves or not. In fact, I think it might be more risky, because that glove's going to slip around, and then we're still talking about being human beings that, you know, are prone to injury. I don't want to change things so much that now our grip is going to be different, or we're going to slip and slide, or, you know, it's something that might injure something when I don't think there's a lot of benefit. So I'm not recommending gloving for really anybody. That's my personal thoughts. Ladies, any?
I agree completely. I'd rather you wash your hands right before you start dancing together. And then wash your hands again right afterwards. I think people are much better about washing their hands and cleaning their hands than they are about washing their gloves. So
100%. And I think the other thing too, as far as washing hands go, is with masks. And so whenever I'm using my mask, I don't know if you saw it whenever I came, I had to step out for a second, but when I took off my mask, I used my hand sand before I touch my mask anytime. So I hand sand before I put it on, I hand sand before I take it off, or after I take it off, just because I want to be sure and keep my hands clean from the thing that I'm touching. Because, you know, I don't know what's been not in my person because it got on the front of my mask. And then the way I store my mask is I don't just like sling it and set it down. And so you don't want to just have it out and about sitting on your desk upside down. You know, here's one that I just took off. It was sitting in this bag. I put it in just a bag, to where that way it's not sitting on anything. And whenever it's done, typically when I take it off, it's done for the day. And then I go to the next mask. So my next mask up is going to be my Boomer Sooner mask for today. And so even just a little plastic bag, I just keep it in different things just to keep my dirties in this one, because then I throw the whole situation into the washer. And then I'll usually just have my cleans in a plastic bag, and that'll be the one that I'll use for the afternoon. And I think it's reasonable to keep it on, you know, just pull it off to breathe. But if you're taking it off to set it down, just consider that mask soiled. You know, all this cloth mask stuff is new for us. You know, we're used to these surgical masks. That's all I've ever known. And so in the beginning, when, you know, the CDC was initially like, oh yeah, you guys don't need a mask. I mean, that was for conservation only. They were like, you know, we think save it for healthcare. They'll be in contact with it. We don't really think people that's necessary. Okay, we were wrong. Let's just say it out there. We were wrong in science. That was just what we knew at the time. Then cloth masks. The next thing when people are making all of these, I'm like, oh, I'm sure it's probably given people something to do, but I'm just not sure they're effective. Again, wrong. Just putting it out there. Wrong about that one. Now we know from the Florida Atlantic and Duke studies that they do work. And so I think making sure that we're taking good care of those, but we're still treating them like a surgical mask in the sense that when it's done, it's done. When it's soiled, when it's wet, when it's gone to been set down, you probably need to have a new one ready to put onto your face. And I know that's hard to do. I'm not always perfect about it myself, but I know usually at lunchtime, that's the time that I switch out to a new mask because I've taken it off, I've put it in the bag, and the new one's gonna go on my face because I've talked on it all morning, so it's kind of damp inside. And so talking to your dancers, that's an easy thing to do. You keep it on, you clean your hands, take it off, take a breath, keep your hands clean. Other than having peely, gross hands, it's not gonna hurt you to wash your hands this much. And so I think that that's my biggest thing for mask maintenance. Then after a wear, this is not going to be one that this is my around the town mask that I just keep in my car and I put it on my face and I wear it for months at a time. Wash your masks. If you've got the cloth masks, wash them. If you've got the surgical ones, throw them away. This is one that another thing that we should also be thinking about, they harbor bacteria. And so this is my mask from this morning. And so you can see all my makeup on the inside. So my makeup has come off. And if my makeup can come off on the inside, all the bacteria from my face and inside my mouth can also come up on that. And so if you don't want to have maskne on your face, and if you don't want to deal with just all the gunk on your face, wash your masks. Will you make yourself sicker by wearing a mask? Because that's another thing that I've been asked. Well, what about all the bacteria that's getting trapped inside your mask? No, that lives inside your person anyway. You're literally just getting your own stuff back on you, but you don't want that up on your face all the time to get, you know, gross skin and all of that. So keep your cloth mask clean, your surgical masks, throw them away when you're done and get a new one. They're not that expensive anymore now that we've got supply. And make sure you're just keeping your hands clean for the donning and doffing. That means the putting them on and taking them off. And then keep them stored. I don't want your mask up against your dance shoes because that's just nasty. We still got to think about keeping things clean anyway. So just have a special place for it. Plastic bag is fine. But I think that that's all of my questions as far as the long list. I hope I didn't lose anybody there.
Fantastic. We're going to talk very briefly about mask shaming. We're going to talk just a little bit more about group photos if people have just a couple more minutes. Dr. J or Dr. Meier, do either one of you want to go ahead and start with either of those topics?
Meier, if you're in a hurry, do you want to do group photo and I'll do shaming after?
I'm not in a hurry. I saw who I needed to see.
Okay, good. Okay, so I'll do shaming really quick just to touch on it. So it's really interesting the way this has come to be because initially I think people were being shamed for wearing masks out in public because we were like, why are you doing that? That doesn't work. And it's partially true. People were wearing masks for the wrong reason, right? They were wearing masks to try to protect themselves, but they were wearing cloth masks that, as we have said, the virus can technically permeate past. What we realized down the road is that the mask is not to protect myself. The mask is to protect me from spewing respiratory droplets onto all of you. And so then all of a sudden it was like, how dare you not wear the mask? And so that's been a really interesting turn of events over the last couple of months. And I think that some people are finding that they are being shamed for not being able to tolerate the mask. And as I had mentioned previously, I think some of those people have legitimate concerns and have real issues and potentially have not found a mask that fits them properly and just don't realize that there are other types of masks that they could try. For example, something like a buff, which this thing, I wear this like when I go skiing, but it goes over your head and then comes up over your face. It's a little bit easier to breathe in and definitely doesn't come up right against your face. And so there's a little bit more airflow. Now, is this as good as a double layered or triple layered mask like this? Again, no. But can it maybe be something that you can have around your neck, and then when you do get close to people, you pull up briefly over your nose? Yeah, it can. I think the issue is that people are seeing anybody who's not wearing a mask as saying, those people don't care about me. How dare they? That is rude. That is an affront to public health. You don't care about anyone but yourself. And I admit, I even think that. If I take the subway here in New York, which it is mandatory that you wear a mask on the subway, and I see someone not wearing it, I automatically am like, how dare you? Because I'm trying to take care of all these people. So I think it's about changing our thinking. I think it's also for the people that do have a hard time with the mask to really, really try to find something that is a little bit more tolerable, or that they can kind of keep close by, so that when they are within that 6 foot range of someone else, that they can just very briefly pull up. It's not going to increase your heart rate that much, that quickly. It's not going to increase your breathing that much, that quickly. It's not going to cause you to have a syncopal episode. The other issue, and this is very unfortunate, but there are many people that are taking the whole concept of getting, a medical waiver from requiring a mask, and they're getting these waivers for things that are not necessary. And they are basically ruining the amount, like the realness of this issue for some people. So, people joke about the Karens. I'm sorry if anyone here is named Karen, but the Karens all complaining about everything now. And so they're like, I don't want to wear a mask. I don't have to. Well, you're right. You don't have to. You also, I guess, technically don't have to wear a seatbelt, but it is mandatory by our governing law, right? And so we are asking, as a public health issue, this is a mandatory requirement now in a lot of states. And so I think doing your best to find one that fits you is important. And I think for everyone else, if you see somebody who is not wearing a mask, remember that there are a few people that really, truly just cannot tolerate them. And we're also wearing these masks for those people, those young kids especially. And lastly, I think if you cannot tolerate a mask, absolutely, then maybe that's when something like a face shield is better than nothing. It will make it look like you are still putting in the effort. It will quell other people's concerns that you are not thinking about their well-being, and it will still give you the ability to breathe comfortably and not risk your own well-being. That's my thoughts, briefly.
I love that. I want to add one thing to that too, is that, I think with the mask shaming, obviously in public, it's probably not the best time for me to have a confrontation and talk to somebody about why they're not wearing a mask. Sure, I don't control that space. That's not my space. But whenever I'm seeing patients in my clinic and I walk into a room and the patient has their mask off, which we require masks in my clinic, that's an opportunity for me to talk about it, to ask, tell me about that. Let me have you go ahead and put that on your face. And let's talk about your concerns about it, and approaching it from a place of concern and caring, which you guys as studio owners and teachers, that's you guys. You guys control your space as well, and you are concerned about your dancers. You care about them. And so I think individually approaching them or the families, not from a confrontational place, because unfortunately this has become a politicized thing. Take all that kind of emotion, if you see yourself feeling it or you see someone else feeling it, and just meet it with what we need more of anyway, love and concern. And so ask your dancers, ask those families. So tell me what makes you uncomfortable about it. I've been watching and talking with these doctors, and let me kind of help you troubleshoot some of that. Let's try to figure out a way to do this, like Dr. J said, in just a doable way that works for you. And some things aren't going to be right for everyone. I've heard a lot about like kids with big time sensory issues and autism. And it's actually, my best friend is an occupational therapist, and she's actually been able to work with some of these kids on things that they can do. But we've got to have grace with some of them. And so I think approaching that piece and helping work with the parents is going to be the way you get compliance. Because I'll tell you what, I have 100% compliance with masking in my office because we take the time to help these patients understand how we do this. Are they doing that on the outside? I don't know. But when they're in my space where I can control it, we found a way to meet them where they're at, to keep them safe and keep us safe. And so I think thinking about that piece is you don't have to necessarily be the dictator and the way you address it, but you do need to be strict about having that mandate for your studios. And, you know, if you've not been masking in your studios, we are not judging you. We are not saying any of this as a shaming thing for you. We are just giving you the data that's out there so that you know how to keep your studio safe. And just because you've been doing something before doesn't mean you can't change and do something different now. And so that's not shaming. That's just our concern for you, and do the same thing with the students you've been working with.
Yeah, dancing's a privilege, right? And we are lucky that we're even having this conversation right now. There's a lot of sports that have been pushed to the spring. They're not even allowed to exist right now. So the fact that we're even working to try to figure out how to make this happen is amazing, right? So we just have to do, all of us have to do our part, our little part that we can to try to make this go as smoothly as possible. That's all.
And the one thing that I just want to add to that is when it comes to like this whole medical reasoning why to not wear a mask, that doesn't mean that you don't still have the potential to shed the virus. So in healthcare, if you have a medical waiver, oftentimes that means that you will be doing like telemedicine visits, or, you know, they're going to give you administrative duties to do. That doesn't mean that you're coming to work without a mask on. So I think that it's important to understand what that does and doesn't mean too.
You don't have to let them dance. You know what I mean? Like, you don't have to let them into your facility. All this ADA stuff people are waving around, you know, it's a little bit different deal. You know, you can accommodate, you have been accommodating everybody for the past 6 months with Zoom and all of that. So be creative about how you're able to accommodate. And so, but don't risk your whole space, you know, if there are people that are not able or willing. And so it's very unfortunate. And I hate that for people who can't, but that might be, like Linda said, a place that you have them maybe just do more remote classes for their own safety as well.
Yeah, it might not be worth it. And you should think about that for yourselves too. If you're out there and completely unprotected and you have an immune system that's maybe not as good at fighting off viruses, then maybe you're really not the person who should be taking dance classes in person right now anyways. I mean, think about your own health too.
Right. And when it comes to the ADA, the key word that people tend to leave out is reasonable accommodations. So if you have a small business and you have some, one person that wants to come and work with you and they're in a wheelchair, you're not required to build a ramp for that one person. If I own a hotel chain, I'm required to have handicap access and make it accessible for everyone. But it's reasonable. How much it inconveniences the business owner versus, what that person needs. So it's, those are just other important things to think about.
Yeah. Let's do pictures, quick.
Group photos, yes. Dr. Meier.
So we've been seeing lots and lots and lots of pictures that people are doing great through their classes and they're posting these amazing videos dancing and they're all masks off to do pictures. That's so tough because, like I said about recitals, that the virus doesn't care performance versus practice, it also doesn't care picture or dance. And so taking a quick picture, I'm sure there are, some ways safer than others, but if we can still try to keep our space, all of that, try to do something, maybe we're standing up from a chair and taking a picture looking down. I think that's the better way to group rather than everybody piled on each other. I just don't know that it's a good idea. I know Dr. J had some ideas that she had mentioned that maybe we could try real fast, but I think in general, like trying to keep people from doing all these pictures, or just picture in your mask. If you're going to get close, at least keep the mask on your face, Dr. J, what are your thoughts?
Yeah, I mean, like you said, I think people are going to take, especially the youth. I hate saying the youth because now I feel like I'm not youthful anymore, but the youths. I think a lot of them are going to take pictures regardless of whether we tell them it's not a good idea or not, a lot like Dr. Meier said. So, if they are, then they should be in the masks, or you should figure out a way for it to be socially distanced. If they're in a bubble together, that's a whole different story. But again, most of these cases are not in bubbles together. So my only other thought and again, this is legitimately just a thought, is that they have their masks on when they get into that pictures. For like 1 second, they all hold their breath, take their picture, and then the mask goes right back on. Now, nobody's gonna look good in a picture like that. That's not gonna be, so I think you're more attractive with the mask on in that situation. But worst case, like that might be the thing, is that you say, hold your breath and then literally put your mask right back on. But again, that is not what we're recommending. It's simply my way of saying, okay, is that better than nothing? Maybe. But this is a giant maybe.
I'm going to add something.
All that work, you know, all that work to protect yourselves and then go stick yourself in a crevice together.
True. I saw the message or the note, what about 3 and 4-year-olds? I think that's a great question. Literally the only time I've had trouble with my own littles masking, and we have practiced all summer, was yesterday when my daughter took her mask off because she was hot before she got on the bus, and then she left it outside on a bench before she got on the bus to come home. I was very unhappy with this, and now since we will be doing the little clips that you can get, there's like strings that you can clip to them, so that way your kids, if they do take them off for a second, aren't setting them down. So I have now found, since our last meeting, a barrier to the masking piece with littles. But by and large, they are good at it. My 3-year-old is a total pro. She keeps it on until I tell her to take it off. We have actually done some dance classes with it on. I actually let them go to gymnastics because they're spacing at their gymnastics and their little kid classes with the masks on, and they did awesome with their masks on at gymnastics. And so, and I mean, she's rolling and flipping and doing all those things, and yeah, she did just fine. And the other kids in the class, like all of them are like 3 and 4-year-olds in this class, they did just fine as well. So I think it's doable. The kids, I had visits today. I was just making a mental note of the kids and the adults in the visits. All of the adults are touching and messing with their masks. I had to remind them to bring them up over their nose. Not a single kid messed with their masks when they were in today. And that was ranging from a 3-year-old all the way to a 17-year-old. And so you can have them do that. It's perfectly reasonable to do it with these little bitties. They're pretty compliant at this age, especially. So I would encourage it.
They're pretty adaptable.
Adaptable.
Yeah, you tell them this is what we're going to do, and they'll do it. As opposed to adults, which, like you were just saying, I mean, I've had people who pull down their mask to talk to me and then put it back up, and it's like, what, you know, it's so frustrating. But anyway, this is great seeing everyone on the webinar today. We really appreciate your attendance. We hope this was really helpful, and please do continue to submit your questions. The 3 of us are also working on some kind of consulting type thing that we might be able to offer, because we know that there have been some requests for some individual, you know, kind of an extension of this, wanting some, you know, either like a 30-minute phone call or a presentation that would be specific to your studio, or reviewing, you know, like an opening plan or, you know, rules for your studio. We are working on developing something like that, where we would like to offer that. It would be through Doctors for Dancers is what we've decided at this point. So you can contact them, let them know if you're interested, and we will be working with them on the logistics. So if that's something that you're interested in, be sure to let us know, be sure to let them know, and make sure to follow Doctors for Dancers. There's lots of other great programs. All 3 of us are also on Instagram, and so you can get our contact info through Doctors for Dancers, and our bios are also on Doctors for Dancers. So hope you all thought this was helpful. Great to see you. And yes, at Columbia Dance Medicine is Dr. J. Mine is at Hypermobility MD, and at the Dancer Doctor for Dr. Meier. Oh, I can't even type, and it's gonna probably make noise.
Thanks everyone for coming.
Thank you,
we really
guys.
appreciate you guys.
Thank you so much, everybody.